In the emergency room, the most serious cases go to the state's only Level 1 trauma center. As our Colleen Chin tells us tonight, the center is being stretched by a budget that isn't even theirs.
Well, Kelly, state budget cuts are far-reaching, especially when it comes to the Department of Mental Health and Substance Abuse Services. Their cuts are threatening emergency rooms across Oklahoma. The stakes are high at OU Medical Center. Accidents. One might think that's what keeps OU Medical Center's trauma unit in the ER busiest. But half of Dr. Roxy Albrecht's time is now spent on alcohol and drug-related injuries. Half.
You guys, it's hopelessness, you just know that person's going to come back.
That's because state budget cuts have cut the lifeline Albrecht once sent such patients to.
We've had to eliminate both substance abuse service beds, somewhere around 80 beds throughout the state. And as far as our mental health beds at Griffin Memorial Hospital, we had to reduce the hospital cap by about 28 beds.
May not sound like a huge number, but each bed lost is opportunity lost.
We already are having a problem getting our patients in.
People become sicker and sicker because they don't have that opportunity for an early intervention. The sicker they get, the more they need services. So where do they end up? They end up in our emergency departments.
It's making for a more crowded trauma ER of repeat offenders who could have been rehabilitated.
When they call for help, they need help then.
Not getting it and clogging the system means the rest of us could have a harder time getting help when we need it most, should we or a loved one ever be clinging to life.
There is no other Level 1 facility in the city or in this part of the state that can care for those critically injured patients. We are going to become more and more busy, and we are going to lose opportunities and possibly lose lives.
And so far, Oklahoma's Department of Mental Health and Substance Abuse Services has eliminated about $20 million from its budget and are expecting to face up to 12% additional cuts in the future.